Hello, my name is Brandon. I am a respiratory therapy student at YTI Technical Institute, and today I'm going to discuss incentive spirometry. Uh, the purpose of incentive spirometry is to guide the patient to take a sustained maximal inspiratory effort and maintain the patency of the airways that are at risk for closure. Um, IS is designed to mimic natural sighing and encouraging patients to take slow, deep breaths. Um, Taking slow, deep breaths opens up the alveoli and keeps them open, keeping the patient from getting atelectasis. Some indications for IS would be any upper abdominal surgeries, thoracic surgery, and if a patient has COPD, they automatically get a incentive spirometer. The surgeries is because the patient is in a lot of pain due to their incisions, and they don't want to take a deep breath, so they just take minimal just to get by, and then this further complicates their condition. Some contraindications: a patient cannot be instructed or supervised. A lot of patients that know they're not being watched will refuse to do it, and this is bad for the patient and will further lengthen their stay at the hospital. Or a patient will not cooperate or is unable to understand or demonstrate the exercise. And presence of an open tracheostoma. It's not a contraindication, but you just have to adapt so the patient can use the exercise. Some hazards or complications would be ineffective unless clearly supervised, or not recommended for sole treatment for major lung collapse or consolidation. These patients that have major lung collapse will often have to get other treatment and maybe even further surgeries. Another hazard is hyperventilation. Patients usually rush to get by, so you're out of the room and back to their self, so they just quickly do it. This often results in fatigue and acute respiratory alkalosis, which that is the most common. Symptoms of this is dizziness and numbness of the mouth. So it's really encouraged that you tell your patients to do slow, deep breaths so they don't wear themselves out and cause further complications. Some other hazards would be barotrauma, especially with emphysema patients because of air trapping. They also have just discomfort due to their pain and exacerbations or bronchospasms. There's two types of incentives. One is volume oriented, which measures and visually indicates the volume achieved during a sustained maximal inspiratory effort. And there's also flow oriented, which measures and visually indicates the degree of inspiratory flow, which I have the flow oriented right here. It's very simple to use and very simple to put together. It comes with a mouthpiece and tubing. Tubing goes here, and these often come with a guide book with it. It goes by the patient's height and weight, and that will tell what the patient should be able to do on the incentive. But a lot of these patients are in a lot of pain and will not be able to do what they're supposed to do, so just coaching them to do the bare minimum, just at least give a good try and a good effort will be good enough. By the end of their stay, they should be able to go more than half. And if the patient is still in a lot of pain whenever they leave, they can take this home with them. They can do it at home if they're not being very active. It's very simple. I mean, kids can do it, or elderly people can do it. It's just important to take slow, deep breaths, not to wear yourself out, and you want to keep this little ball between the lines on the side. If not, the patient is doing it incorrectly, and they're often going too fast. Some outcomes of incentive spirometry is absence or improvement of atelectasis. They can have decreased respiratory rates. It can even resolve fever, and their pulse can normalize. They could have absence of crackles or presence of improvement in their breath sounds. This is why it's very important to do your vitals before and after the exercise, just so you know if there's any improvement at all. You'll really hear a difference in your breath sounds. And also another outcome is either clearing of the x-ray or going completely normal. You could also have improved PaO2 and decreased alveolar arterial O2 tension gradient. You can have increased vital capacity and expiratory flows. You can have return of the FRC or vital capacity to preoperative values. Just overall, the patient should feel a lot better. You should be able to take a nice deep breath without any struggle. So good coaching and persistence will help your patient get back to their normal selves with the incentive spirometer. I hope this video was educational and helpful. Thank you very much.